Should I worry about a positive TB skin test result? Getting a positive tuberculosis skin test can feel a bit unsettling, but it's important to understand what it really means. A positive test shows that your immune system has reacted to TB bacteria, but it doesn't automatically mean you have active tuberculosis disease. It could mean you have a latent infection, where the bacteria are present but inactive, or it could mean you have active disease that needs treatment. When you get a positive skin test, your healthcare provider will usually recommend additional tests. These often include a chest X-ray and sputum tests, which look at mucus you cough up to check if the bacteria are causing an active infection in your lungs. If these tests show no signs of active disease, then you most likely have latent tuberculosis infection. This means the bacteria are dormant, and you don't feel sick or spread the bacteria to others. Most people with a positive skin test actually have latent TB. But it's important to remember that latent TB can become active later, especially if your immune system weakens due to illness, medication, or other factors. About 1 in 10 people with latent TB will develop active TB at some point if they don't get treatment. That's why medical follow-up is essential. Treatment options are effective for both latent and active TB. For latent TB, treatment usually involves taking antibiotics for about 3 to 6 months to prevent the bacteria from becoming active. If you have active TB, your doctor will prescribe a longer course of multiple antibiotics, often lasting around 6 months, to fully clear the infection. Certain factors can increase the risk that a positive TB test means active or progressing disease. These include having HIV, recent close contact with someone who has active TB, or being immunosuppressed from medications or health conditions. Also, if you have received the BCG vaccine, which is used in some countries to protect against TB, it can sometimes cause a false positive skin test. Your healthcare provider will consider your vaccination history when interpreting your results. In summary, a positive TB skin test is a sign that you need further evaluation, but it's not an immediate cause for alarm. It's a prompt to see your healthcare provider for proper diagnosis and possible treatment. Early detection and treatment are key to preventing the bacteria from becoming active or spreading to others. Remember, your healthcare team is there to guide you through the process and help keep you healthy. Always follow their advice and get regular checkups if you have concerns about TB.